Good evening, everybody. On the behalf of Respiratory Conclave Conference 2020, I, Abhishek Keshri, welcomes you all. जैसा कि आप जानते हैं कि हर साल की भांति इस साल भी हम लोग जून के महीने में रेस्पिरेटरी कॉन्क्लेव कॉन्फ्रेंस करते रहे हैं और इस बार का बर्निंग टॉपिक हर साल की तरह कुछ ना कुछ डिफरेंट रहता है और इस बार भी हम लोग कुछ बर्निंग टॉपिक लेकर के आए हैं। तो इस प्रोग्राम को आगे हम बढ़ाते हैं अपने प्रोग्राम कोऑर्डिनेटर के साथ। हमारे साथ हैं साक्षी पाठक।
Namaste and good evening, everyone. First of all, I would like to thank Dr. S.K. Pathak, the organizing secretary and the organizing team of RCC 2020 for selecting me as the program coordinator for this conference. I, Sakshi Pathak, I am a medical student at IMS BHU. मैं इस साल के RCC कॉन्फ्रेंस की प्रोग्राम कोऑर्डिनेटर हूँ and I, on behalf of Dr. S.K. Pathak, organizing secretary and the organizing team of RCC 2020, would like to welcome respected speakers, panelists, webcast viewers, and Facebook Live viewers to RCC 2020. The RCC conference is organized every year by Breath Easy Chest Foundation for Humanity and co-sponsored by Breath Easy Hospital, अस्सी वाराणसी। ये 5वीं RCC कॉन्फ्रेंस है और ऐसा पहली बार हुआ है कि यह कॉन्फ्रेंस वर्चुअल प्लेटफॉर्म पे आयोजित की जा रही है बिकॉज ऑफ द कोविड-19 पैंडेमिक।
Question is, what is the place of allergy testing and immunotherapy in the allergic diseases during COVID-19 era? What do you think?
Is given by the Indian College of Allergy, Asthma and Applied Immunology after the COVID pandemic, and that the pandemic and epidemic of this COVID-19 immunotherapy either postponed or delayed or handled through the virtual care. It should be discussed during the lockdown, during the pandemic time. So if we need to do it, then we do it with precaution as given by the government of India regarding the COVID precautions. Hello.
Hello, yes, you are audible.
So regarding diagnosis, the two things are important. First, to diagnosis, and the second thing is the management. Diagnosis, yes. Already told and explained everything how to diagnose the patient. It's a either virtual or video conferencing through. And if the patient has come to you in a hospital, then it should have a proper place with exhaust fan inside the room, a negative pressure, with provisional of diagnosis and management on the basis of symptoms and history of the allergy and the family history and duration of history. With a history of atopy, you have explained the definition of atopy. So the telehealth and virtual care has to be taken care. Face-to-face interaction has to be avoided, and if examine all the precautions and guidance to be taken on the preference. So patient skin prick tests, sir, as you have told, that should be avoided during the lockdown period. And regarding
because of the fear of the infection control, yes.
Definitely. If we have to do in certain, if emergency and COVID emergency, because of the COVID condition, the allergic condition is very important. Have to do the test. For example, venom allergy cases that we have to do and alert because of the allergy, the patient disease condition is serious, then we do it with all precautions, wearing the full gown, apron, and PPE kit, I mean N95 mask, and then only we do the skin prick test. And after, if it can be avoided, then avoid it and do a serological test in certain cases. And regarding the management of these COVID patient with allergic rhinitis or allergic asthma, then as sir you have told, the nasal allergy or allergic asthma due to extrinsic allergic asthma, so we need to give the medication and
Okay. So I think Dr. Tariq, let me say in a nutshell that during the COVID pandemic, when you cannot know that if somebody has a COVID, because 80% patients are asymptomatic. So, and allergy testing is not a very emergency procedure, as you said, except in a very rare situation. So usually they should be postponed. And as far as immunotherapy, if somebody is already taking immunotherapy, there is no contraindication to use immunotherapy. But somebody you have to start afresh, then you can wait till the some time. And one more question I would like to ask you. Suppose somebody had a gap because of lockdown period. Many people who are taking immunotherapy, there have been gap in their immunotherapy schedule. Then what is the guideline says that how if he restart, then how he should restart?
yes, the guideline has mentioned, Indian guideline particularly, the patient on allergen specific immunotherapy on injection may be suspended till the lockdown period is lifted, and if he is on injectable immunotherapy and come to us after 1 to 2 month gap, then continue with at least a lower dose.
Yes.
And
yes. So what happened? Yes. Go ahead.
If he comes up to 2 to 4 month interval gap, then continue with the last dilution.
Yes.
And if it is more than 4 months, then restart as a fresh. And
thank you, Dr. Tariq. Yes.
Sir, biologicals are not advisable in a fresh case, in a new patient during the pandemic period, and those who are using it should continue.
Yes.
Should continue.
Because one thing is very clear, that these immunotherapy, they affect the TS2 cells. But as far as COVID is concerned, they are related with mostly with TH1. So ideally speaking, there is no contraindication. But depending upon what is the situation, what is the ratio of getting infection to the healthcare. So this should be
COVID rate. So during the patient interaction, and might be a carrier and asymptomatic having COVID. So all the precautions to be taken because of that reason.
Thank you, Dr. Tariq. Thank you.